this. Okay, we're all set. Okay, so just so everybody knows, these What's Next discussions, what we've been doing on a weekly basis is really focusing on new and innovative technology that's out there, that's supporting a better world for older adults, professionals, and their loved ones. And you know, sometimes we address an overall topic like voice technology. Other times we address a company or a product that is out there. And today we're going to be focusing on a product, ICmed. And I always like to add this disclaimer. This is, I don't ever want these sessions to appear like we're doing an infomercial for a specific product. The goal is for us to learn about something that's out there for older adults that could improve their lives. But the other goal is, and this is one of the cool things about these innovative technology-based companies, is to sort of hear the journey that the entrepreneurs went through. Because even before COVID-19, you know, starting up a tech company requires a lot of pivot and innovation and sort of making mistakes and adapting on the fly. And I love hearing those stories, and I think that they can be inspirational to all of us, because whereas making these adaptations is second nature in a sort of a tech-focused environment, for those of us who are in sort of traditional senior living, it hasn't really been part of our culture. But now with COVID-19, we all have to sort of adapt and change to the environment. So, you know, listen to those types of things that these pioneers are going to be sharing with us today, as well as them giving a demo of the products that they've created. So with that, I want to welcome our 4 panel members, and I'm just going to sort of go. Well, let me start with Tejas. Tejas, yeah, because Tejas, number one, I wanted to make sure I got your name right. Tejas has been on a lot of our online discussions, and he's the one that reached out to me to sort of share this this product as a topic. And so Tejas, you know, tell us a little bit about yourself, and then we'll go around and meet the rest of our panel members, and then we'll kind of jump into the discussion.
Sure. Happy Friday, everybody, and thank you very much. I see a lot of attendees who are already sharing their information, which is great. We definitely want to welcome that, you know, card exchange, as you put in, Steve. And thank you, Steve, for this opportunity that you have, like, you know, having us, the panel members from ICmed, present today. Personally, me, you know, I go back into technology several years, and then over the years, I've you know, put on different hats. You know, coming from a technology world as well as from a finance world. You know, I am part of the ICmed team right now on the strategic as well as advising panel. And I also help them, you know, to create new ideas and new features on for the products. But at the same time, we want to go strategically into the market. And that's one of my roles as of today. If I can be of any help to any of you who are listening today, who want to, you know, integrate the ICmed product into your businesses, more than welcome to contact me or any of us on this panel today.
Great.
Thank you very much.
Okay, and then I'm just going to go to my left as I'm looking on the screen to Michael Allison. Michael, tell us a little bit about yourself.
Thanks, Steve, and thanks everybody for attending. I'm a physician. I'm trained in critical care medicine, internal medicine, and emergency medicine. And I became interested in ICmed after sort of a personal journey of illness last year. having an orthopedic problem that led me need to go to a couple different consultants, liaison with my primary doctor, imaging centers, rehab facilities, and just the way the communication was going, was the same that someone 10 years ago was going through this. Compact discs with images, faxes, the occasional email, but it really seemed like this system is siloed and disjointed. And I like the fact that ICmed creates a solution to put all of these silos together, as I think we'll talk about today.
Great. I'm really glad that we've got a doctor's perspective on the panel, so that's fantastic. And then
yeah, and I'm actually speaking as a patient in many ways. Doctor
okay.
as patient, but I fill both roles.
Even better. Okay, great. And then under Michael, I've got Anil. Anil.
Hi, Steve. Thank you. Thanks, everybody that's participating today. So I'm the CEO and founder of ICmed, and the journey that we've had has been actually very personal. So kind of Mike gave a little tidbit on his experiences as a patient. I had some experiences long time ago, and really it was just the concept of ICmed was born out of this idea of collaborating around health for families. My background is software. Been developing software for a little over 21 years, and started several companies. And so ICmed was a product that I came up with really the help of my family, so that everyone could collaborate with each other and stay connected. And so I created this little product and tossed it on the App Store, and thousands of people all over the globe downloaded it. And wasn't really expecting that, but it told me something very interesting, that healthcare and people being interested in their own health, it was a product that people were looking for. And at the time, I'm not a healthcare specialist by any means. I developed some healthcare software over the years, but I shared the idea with many of my friends who were in healthcare, and they mentioned something to me interesting. They said that that this was striking on a chord of what basically is known as patient engagement, and what I was told was patients who are engaged often have better outcomes, and it actually lowers costs overall for the healthcare system. And so when I learned that, I said, well, that's great. I mean, it sounds like the formula is pretty clear. Why hasn't anybody done this before? So, and as an entrepreneur, I was thinking to myself, well, you don't want to generally do something that others have done, or maybe, and so I learned very quickly that for decades, the healthcare system has been trying to engage patients unsuccessfully. And so of course, when I started with this project, I assembled a team and I began to say, we want to do some research and understand sort of the mentality of patients. And what we learned very quickly as we were doing our early stage research, this is a little over 5 years ago, we found out very quickly that patients, although they care about themselves, they don't care about themselves as much as we'd like them to, which is why when you go to the doctor and he asks you to lose weight, exercise more, eat better, all of those critical things that docs will always tell you, pretty much every year they tell you the same thing, and but what we did learn was patients really cared about someone else more than themselves. And so that was our aha moment. And I said, well, maybe we've been doing this wrong all along. Maybe we've been engaging the wrong person. And so if we could engage that family caregiver or that loved one, that, the one that's really doing the caring. So as an example, perfect example is a mom, a mom who cares for children and cares for the aging parent. Oftentimes at 11:30 at night, they start to think about themselves. And so you can see how that happens. And, so we began to start our journey and said, instead of building a platform for patient engagement, we're going to build it for family engagement. And that was really the core of what the product was. So
I love it. No, really, from a philosophical position, you're dead on. I think that everybody in the audience, especially those of us in aging services, we care more about other people than we do ourselves. We sacrifice ourselves way more than we should. And I love it. So great introduction. Awesome inspiration as well. So our last panel member, let's meet him, is Jim Jacobson. And you just got to unmute.
Hi, everybody. Happy Friday. Steve, thank you for the intro so far and hosting us today. I guess I joined the company as the second person, and it really was the result of being inspired, as Anil just had that, as Anil just inspired everybody about his journey. I did not have a background in health. I'm a CPA and involved in all aspects of the operation, bringing it together. We've been doing this for over 5 years. We've come a long way. Steve, your comment about pivoting and just all of the frustrations and the highs and the lows that go along the way are spot on, but it really helps you to grow and become stronger. And I think as a result of that, we are really kind of focused and hitting the nail on the head when it comes to connected care and everything that revolves around that. So I'm looking forward to speaking to everybody today, and happy to answer questions along the way.
Great. Okay, so I think I'm gonna toss it back to Anil now, because I believe you were gonna sort of walk through a demo of the product, correct?
yeah. So
Okay.
what I think I'll do is,
So before you kick that in, what I'm gonna do is I'm gonna take myself and Jim and Michael off the screen. I'm gonna stop our video. That way, when you're sharing your video, it's just you and your PowerPoint. And then I also want to remind everybody that to type in your questions in Q&A. I see there's a few good questions in chat. Make sure you just cut and paste those over into Q&A if you don't mind. And then as we sort of take pause breaks, I may sort of say, hey, if you got a question or what have you, you can raise your hand, or when we get to the end. So here, you can go ahead and share your screen now. And then I'm just gonna take our video off, and you may hear my voice from behind the curtain. Okay, so that looks good, Anil.
great, yeah. So so the first thing I want to do is just really talk about the fact that, when we built the product, we were thinking of this, and remember, this was all based on patients. It was never based on really the healthcare system, which is very unique in digital tech. Most systems that are built today are built, from the healthcare system's perspective or through that lens. Because this product was born on the patient side, it was much more, I think it's much more useful to patients, which therefore they want to engage in this. So you'll see here that we're talking about own, share, and learn. And own, share, and learn is kind of our mantra, if you will. We believe that patients should own their own record, and they should be able to share it with who they want, and they should also be able to learn from their record, their connected individuals, as part of their social health network. And so knowing that, we knew that we couldn't omit the healthcare system. It was part of the overall healthcare stakeholders in the process. So in order to complete the triad, we brought in the family, the patient, and the healthcare, the care team, if you will. And so in order to really think about this from a framework, we began to think about the communication gaps. And so I'm going to show something now that just sort of gives you an idea of the overall solution that the product offers. But I'm going to really focus more on, the engagement from the patient's perspective. And I'm also going to focus on the fact that, the enterprise or the care teams have lots of information at their fingertips, some of which they may or may not need to use. But the beauty of the product is it can really mold to the workflow of care teams and create a tremendous amount of efficiencies. Digital health, the whole concept behind digital health is truly to create more efficiencies. So as you can see the product here, the enterprise can engage patients through a wide range of ways. So telemedicine and scheduling is kind of the first row there. So the product has group messaging, direct messaging. So something that people are familiar with today. So you can, message not only patients, but their care teams or family care members, caregivers rather. And you can also do video calling, similar to Zoom. All of this is done in a HIPAA compliant way, so that care teams can actually seamlessly work in this environment, and everything is tracked and logged accordingly. So you have lots of alerts and tracking available so that you can engage patients remotely, or you can also communicate with families on the behaviors of patients. The last row is assessments and education, which that was something that we really focused primarily on. And if you wanted to know, our IP is built around this personalized education. So the unique aspects of our product were really all about delivering content that was automated, so that there's so much health education out there, so much misinformation, I think, and you probably have seen that with the COVID crisis. But to be able to deliver content directly to somebody's phone, and also directly to people's caregivers, so that they can be educated about what's happening in terms of care delivery, what's happening in terms of treatment plans, all of those things. So the personalized education channel within the platform is something that we're really, really proud of in the way that it operates and how it helps providers to really do their job efficiently. All of this was done in, sort of is part of our mission, but the real top line of our mission is really all about engaging that family caregiver, because we believe they are the influencer of the patient. So, and some of the stats here that kind of give you an idea. I mean, the first one is really, really an important one. And it's actually, everybody knows rehospitalizations cost the system incredible amounts of money. But a simple thing of getting the family involved can actually reduce that by 25%. So ICmed tries to activate those trusted family relationships to ensure that patients, are handled well. And today in COVID, I mean, I think one of the things that I've noticed with, I'm actually going through this right now with a family member who's in a facility for rehab after a hospital stay. And, family is not available to them. And it extends the sort of recovery time because families aren't there. So, all of these facilities are doing the best they can under the circumstances with COVID, with trying to connect people through FaceTime and other means with their families. It is complicated. It's very difficult, and oftentimes frustrating to families. So, we've definitely thought about, how to alleviate that frustration. And a lot of it has to do with the way that we automate the technology. And the real value to the care teams is this ability to create efficiencies with the existing resources that everyone has. There's no new things that have to happen with the workflow in order to incorporate ICmed into, the overall delivery of care. And, being able to monitor and have family members monitor, the progress, I think that's an incredible thing. So, just to better understand what's happening in healthcare, everybody knows this. I mean, our product fits squarely in this space where many of the, I think attendees are, which is, after discharge, what happens to the patient? EHR power gets diluted because, people, it gets fragmented. Lots of things get fragmented, including, just pure communication with caregivers who are a big part of that patient returning back to their daily lives. And being able to collaborate is something that I think we provide that in the platform. And the collaboration is really with all of these new sort of there's an incredible amount of people that are now involved in delivering care to that singular patient. And ICmed sort of binds them with this piping. So, and as you know, there's disparities. And I think Mike Allison had mentioned earlier that there's silos that are built up. And a lot of it's because of actual, technology. The technology does not speak to other technology. And that's been a tremendous problem in healthcare. So therefore we rely on faxing and other things, to sort of transfer information. That's critical. ICmed is this piping, the blue piping that you see here, that can actually, create a cohesiveness amongst the entire, sort of continuum of care. And so that's where we fit the most. Now, I know you in previous, events that you've held, you've talked a lot about sort of the devices that have propagated through the entire system. And, we recognized in ICmed that in order to really fit the bill for the way healthcare is today, but also the way healthcare is moving, we needed to incorporate the ability to be agnostic to the data and make sure that it was efficiently ingested into the system and disseminated to all the parties, including care managers, family members, and of course the patient. So we didn't care where the data comes from, and we wanted to build a system that was very open and being able to interact easily with all folks. So the other thing I'll mention is, with COVID, we sort of, obviously with all of our telemedicine components, it became very evident that we could help in this COVID situation. We were actually called to help up in New York by New York City Health and Hospital System. They were looking to bring specialists primarily from critical care to their hospitals because they were just getting swamped with patients. But sending people from Maryland and other parts of the country to New York posed a risk to those institutions that they were coming from, because they could get exposed and so forth. So ICmed basically created a bridge, and we did teleconsult with the hospitals. And so the hospital docs at bedside were consulting with doctors all over the country and experts all over the country to help better understand what was happening. And the results were incredible. So we were very proud to be part of that solution. But one of the things that we've done in terms of our product is we've created a very simple onboarding and risk assessment. And this can be used by anyone. So if it's a facility that's getting ready to take a patient on board, oftentimes you want to find out information about them. And now I think all of the institutions are doing this. So the system that we've built that addresses these things is really about sending a mobile delivered assessment. And that assessment is like sort of a triage. It's a digital triage, and you can assess patients, assess their risk factors, and then instantly onboard them. Now, this all happens seamlessly. So, in our kind of world, we're not only creating patient records in our system, but we're actually able to create a caregiver in our system. So, that's something unique about the way our data is handled. So you don't have to even, the patient is a 78-year-old woman or whatever. She doesn't have to use ICmed in order to engage with, all the parties that are involved in the communication. But that patient's, older child or some loved one, they're the ones that are sort of the proxy for them. So, so I wanted to take 2 seconds and just sort of pause and let you know that I'm going to show a little live demo so you can kind of experience the product, both from the caregiver side as well as the the provider side. So I'm going to start by showing you, some of the folks that you see here. John Hamilton is the caregiver for Alice. Alice, the star of our sort of presentation today, and she's somebody that John cares for, and John has his family as well around him as well. And I'm going to show you a little bits and pieces of that. But let me see if I can stop sharing for a second and bring on another share here.
This looks really interesting, Anil, and we're getting some great questions that are coming in the Q&A. I see that Jim has responded to some of them via text, so if everybody checks those out, they're probably questions that we're all bringing up. And encourage you to use Q&A for additional questions.
Okay. So I'm gonna share the screen here. Should be able to see my screen.
Yep.
Great. So I'm actually going to just take a moment, show you the app itself. So in the bottom right-hand corner, we have ICmed. I'm going to launch the app. And if you recall, one of the cast characters was John Hamilton. John is the caregiver for his grandma, Alice. And so John can download this product for free. It's the patient app is free. It's on all the app stores. And you can track and manage your own health. There's lots of features here. I won't talk about all of them, but I just wanted to share with you how John actually can add a family member. So down on the bottom left-hand side, you'll see next to Health Home, Connections. So if I click on Connections, you have all kinds of connections that you can add here. So it's not just family, it's loved ones, right? So it could be a neighbor, a friend, whoever it might be. But you have family connections, friend connections, and even caregiver connections. So it could be a professional caregiver in that vein. So they can all be connected through this platform. You'll see Alice there at the top, and it shows that she's a managed connection, which means that she actually doesn't have her own account. She was created by John. And so John, if he's wanting to see what's in her profile, he could just click on her medical data, and now he can track all of Alice's information here. So this is the social health network aspect. So it's very similar to other social networks that you might be familiar with, where you can invite people and share information. You can share some information, all your information, whatever you like. And so you can see that, he can actually look at various aspects of her profile because he created it. He can add medications. He can, track appointments for her, whatever it might be. He can interact with the doctor or the provider that is taking care of her. So these are all things that can be done through the platform. So if you go back to Health Home here and you take a look, on the top right-hand corner, I mentioned to everybody earlier that one of probably the strongest parts of our platform is the educational channel. And so you can see here, this is how the educational channel works. And information can be disseminated by the institution. ICmed also sends some great information throughout the year about various things to the populations that are using the platform. But you'll notice that next to the content, you'll see a little icon of John Hamilton, or a profile pic rather, and it says me. That means this content was designed for him. If a piece of content is being sent to, say, Alice, he would see that here in his feed, but her picture would appear. So what that's doing is it's really informing this caregiver about information that the provider wants to send on behalf of that patient. So, and it's all automated. So there's no additional work that's needed by the provider teams to be able to do that. So really great content, and it's personalized. So, as an example, if Alice is challenged by diabetes or heart disease or whatever it might be, you know, she's getting information that's relevant to her, and her family can read that and react to it. So, this is just kind of an idea of how the platform looks from the patient side. And there's lots of features here, so I'm not going to really kind of get into all of them, but you know, the communication channels that we see heavily used today are the chat channel. So the communication and you know, how do you connect to an organization? You know, you can connect to an organization by clicking on settings, and you can just simply connect here. Organization can invite you, or you can be given a connection code. So if you click add and you just enter the connection code by the organization, and all of a sudden you're connected to as many organizations as you want, and you can keep tabs on that information, and you can see who you're actually connected to. So they're allowed to communicate with you. Now, what's unique about our platform, unlike other sort of portals and things that you might be familiar with, is at any time the patient can disconnect. And so we, again, allowing the control of the patient or the family member, they can disconnect from organizations, but they keep their record. And so the record becomes very portable to them. So now, very quickly, I'll stop sharing, and I'm going to share another screen with you and show you what the providers see.
Neil, while you're pulling that up, there was one question about how many apps does ICmed have, and is there a specific app for home healthcare? And I'll just answer that. There's the patient-centered app, which you just saw, free to anyone. Anyone can download that for their own health journey, for their own health history, or for any family member if they want to manage that for someone that may not be tech savvy or able to manage it on their own. What Anil's going to pull up is the second sort of feature of our product, which is we call it the enterprise, which is basically a CCRC or a skilled nursing facility might have the enterprise app, which manages groups of patients with a number of providers. And so you're going to see that. So the answer is two. One, very patient specific, and that data is owned there and is shared with enterprises that they're connected to, which Anil will show you now.
Yeah. So I'm going to log in here as an enterprise. So a organization that's looking to manage their patient population. And in this care, it's At Your Care. That's the organization name. And Fred Johnson is the executive director. So he's sort of the admin for the entire organization, which is why he has a lot of features over here on the left that he can control. And so as an example, in this case, instead of patients, they have residents. And so they can actually click and see all of their residents, very similar to what you would see in an EHR, which is classic. And but I'm going to search for Alice Hamilton. So I'm now in Alice Hamilton's profile, or her record, if you will, so her file. And so I'm able to look at a wide range of features on Alice, and I'm able to communicate with her core care team. Her core care team is over here. You'll see John Hamilton is her primary core care team member, or basically the contact that they would be communicating with, as she is a managed profile. So you're able to communicate with John through video and chat, as you can see. And you can also communicate with any other collaborators that are outside your organization. So if you happen to have, social workers or other people that are affiliated with your organization, or even just maybe external to your organization, you can actually allow them to share information about Alice and be able to work together and collaborate. And this is that concept that I showed you earlier with all the different organizations that could be working on one patient, their care. So the first screen you're seeing is the health journey screen. So it's a very nice timeline of various things that, people are adding data. So you can see who's adding the data, when it was added, things of that nature. So even if somebody's required to take medications, all of this information is populated here. And for organizations, we even have task management. So you can assign tasks to different people within your organization to make sure that things are being handled and managed. So if you are looking at tasks, you can actually, it's very similar to a lot of task management tools. You can add notes and things of that nature here. Medications are all here. So if there's certain medications that the patient's on, we integrate with lots of systems like SureScripts and things like that. So it will pull medication data down. It can pull medication information from EHRs that are referring to a particular facility. So all of this information is tracked. These are all important things that are important to At Your Care, may not be important to every organization. So we can actually turn off and quiet some of these features based on the needs of the particular organization. Of course, you got trackers, and you can actually monitor, anything like blood pressure, things like that. You can look at trends. So it does give you lots of abilities as a care team. You can also get triggered alerts. So if something seems to be out of range, you don't have to be logged in here to be able to see that. You'll get alerts, whether they're SMS alerts to your phone, or as a care team, you would also be able to get push notifications on your phone, and you'll be able to react to those notifications. One of the other interesting things we've built into the platform is this ability to transfer sort of hard copies of things. So you have, if you have a file or a document that you want to send to somebody, such as John Hamilton in this case, you can actually create folders here in this digital file cabinet. The digital file cabinet's available on John's phone. So daily reports, you can actually, easily upload the reports. You can share these with collaborators. So if there's a particular collaborator that is on this file, he's going to be able to see the information that's in this folder. So this creates a lot of efficiencies for organizations, and you're able to just sort of monitor and see what's happening with patients very quickly and efficiently, and transfer this information to all the parties that need to be involved. And so I'm going to kind of pause for a minute, but there's lots of features here, and I don't want to go through all of them, but you can see the depth in which we've created. This is obviously 5 years of work. We haven't, this wasn't something that happened overnight. And a lot of it has been driven by our user base and our organizations that we're working with. We work with a wide range of organizations, healthcare systems, wellness groups, specialty groups, clinics. So there's a whole slew of folks that have helped in creating what we think to be a much better tool, which incorporates all of the folks in the entire healthcare team that's involved with this particular patient. So I'll pause there.
Great. Great overview. And let me bring our panel members back visually, and then let's get to jumping on these questions. Lots of them have been rolling in, and let's see here. Okay. All right. I think I got everybody on the screen there now. All right. So
yeah, Steve, while you're pulling this up, Neil, one of some of the questions that come to us is, how ICmed allows for an assisted living or a skilled nursing facility to communicate with their loved ones or the patient or their clients directly and their family members using ICmed.
Yeah. So, I mean, as I mentioned, as we were looking at it, there's a lot of information I just disseminated, but, ICMed's sort of enterprise version was designed to make it efficient to communicate with not just patients, but to their family members. So in a skilled nursing type scenario, which is, as I mentioned, I'm sort of dealing with that personally right now with a family member, communication is tough because it's all about phone calls. It's all about, leaving a message as a family member. hoping to get a call back because they're very, very busy. And, now I think the call volume has gone up because of COVID, because family members can't visit, can't physically put their eyes on their loved ones. So it's critical to be able to provide information. And that could be as simple as taking a photograph of the person, or video chatting, or whatever it might be. And all of those things are facilitated through ICMed's platform. And so they can not only chat with families, but they can group chat with, all the people that need to be included, instead of getting 7 phone calls from different people about similar issues with the family member. We are always looking for, more ways to connect. But I think, it's just about the way that people are communicating today. Like chat is a perfect example. I mean, I think if you talk to most people today, even, I would say even in the senior community, texting is the way people don't generally phone anybody anymore. So having that ability is there. But so hopefully I answered the question. I think most people in skilled nursing facilities are, they're taxed. I mean, it's a resource issue. So if they have other ways to be able to put notes, or quickly send a chat message to let everybody know that their loved one is okay, then I think that's
what. Now, in the Q&A, 10 questions have already been answered via text, but I just want to recap a few of them, and then we'll get into the rest of the questions that have been coming in. And then this is also the time, as attendees, if you prefer to raise your hand and just ask a question audio, you can do that. But the first question that came in from Catherine McAllen is, who is the primary manager of the system? And we've seen this, but just to reiterate, the individual that downloads the app, you will see in the demo that individuals, that the starting point is the family member, correct?
Yeah. So from the perspective of the healthcare workers that are are participating today, if you were to get ICmed for your organization, you can actually invite those family members in. So they don't have to already have ICmed app, the consumer app. That you can invite them, and then there's an invite process, which I didn't show. But you basically put their information in. And it'll send them a text message or an email, or whatever works for them. They will get a link, and they'll be guided to download the app. As soon as they download the app, they're instantly connected with that organization.
Great. And speaking of which, that was Catherine McCallum's question, but she's raised her hand. So Catherine, you have a follow-up question, or any other questions you got for the team?
Yeah, just to clarify, so you only have one point of contact as a master contact. Would that ever be the individual themselves, the older person wanting to have control of that? And how does that work differ from a family caregiver?
Yeah, so what I showed you in this presentation was Alice, who I believe is 80, if I'm not mistaken, and she doesn't, use technology. She's just, she's being cared for by her family, and but in many cases now, you can connect to an individual. So, like, I'm connected to my father, and my father has ICmed, and he uses it. He tracks his own health. He does everything in ICmed, and he shares that information with me. So, a doctor that he's connected to can communicate directly with him. A healthcare worker can communicate directly with him. They can also communicate with me because I'm noted as one of his core care team members. So I'm actually part of his family healthcare team, if you will. And so he's given rights to the doctor to be able to speak directly to me if needed. So that's an example of allowing the patient to not only be involved if they are capable and can and want to, but so that they don't need a proxy. And at some point, they may just not want to do that, and they just want their families to handle it.
Great. John Butterfield has a long question, but I think a very thought-provoking and important one. Please address what, if any, Medicare, Medicaid reimbursements are now available for your technology, and is this federal reimbursement new pursuant to COVID? I know that the telemedicine has reimbursements that are now tied to COVID that weren't previous to that. How has this changed that as you market to the audience? And he asks about how much more are remote family members important, especially if their loved ones are living in assisted living or dementia care.
Right. So the first part of the question is that, we are actually working with organizations that are utilizing the platform to get credits. For reimbursement purposes, I mean, I think there's now about 20 or so, if I'm not mistaken, codes where CMS is reimbursing based on those codes, which many of them revolve around, the ability to perform a remote video appointment. So our system tracks that information from a billing perspective. It tracks it for ICD-10 codes and CPT codes. So whatever whenever you're having an encounter with a patient and or family member, that will be logged into the system as a billing event. So we are doing that right now. So in terms of I'm not the expert on all the CMS changes, because it's literally ebb and flow right now with so much around COVID. But recently, and maybe Jim can speak to this, recently there's been a tremendous amount of money provided to organizations to obtain technologies like ICmed through grants and so forth. Maybe Jim can speak to that.
Yeah, that's right. I guess I would just first I'd piggyback on top of what Anil said. The rules are changing constantly, and I think as an organization we've kept on top of the general kind of run, and it's a great tailwind for us that a lot of the ways that we connect are now reimbursable through CMS, whereas before they weren't. When it comes to funds that are available to organizations, we know that we have an eye on the list of the FCC is awarded over $200 million to, I forget the amount of organizations, but many, many, many organizations to implement systems around telehealth and connected care. And if you go to the FCC website, you can see the organizations that have received those awards. And probably quite a few people on this call may be part of some of those organizations, because I know many of the organizations we are working with have showed up on that list. So I think it's a great thing that the FCC has done to kind of make this telehealth become a reality for a lot of companies that do not have the resources but that want to do it. Great. So I would highly suggest going out to that website and looking at that.
I'll add one thing to what Jim was saying is people like to think of this as, as a result of COVID, and at some point it will end. I think we all know, and all of our healthcare workers know, that this is not going to end that way. I mean, I think it's actually creating the change that was needed, which is, people want to connect more digitally, and it forced that hand for a lot of organizations. Now, I know it's tough because it's a very, very big lift for organizations to change their workflow. But the COVID, the thing that happened with COVID, people talk about post-COVID. The post-COVID world will be a telehealth world, because that's just the nature of it. So.
Two questions that kind of intersect from Ed Miller and Mary Ellen Connect. Do all doctors' offices accept this and have a code to send you? It seems that my doctor used different systems. Their records are not up to date. So is it easy to transfer records? And then Mary Ellen Connect says, I may have missed it. Does this integrate with PCC or other community EMRs, electronic medical records? Or does it replace those? If it doesn't integrate, who populates it? Or do you have smart BP that integrates. Lots of
Right.
acronyms.
Right. Yeah, I think that's point care click, if I'm not mistaken. But so there's a lot of practice management systems. So the first thing is ICmed is an open platform, which means it was built with the concept of integration. So we are connecting to various different sources of data, EHRs, practice management systems, things of that nature. So point care click is one of them. The other thing to note about our platform is, although we don't really bill ourselves as an EHR, you probably saw through some of the screens I showed, it can act as an EHR. And for many organizations that are both clinical and social, this may be a great record keeper. So you don't need to have another system. So the answer is yes, we can ingest all of that data, bring the patient data over into ICmed if you want to move to a different platform. And our platform obviously is turbocharged because of all the digital connections, whereas Point Care Click doesn't have all of those features. So yes, the answer is yes. I forget who asked the question, but we can do that.
Great. Let's see. This was one that was asked and typed in a response. Do you have different levels of access to protect HIPAA or even privacy? For example, a neighbor, a volunteer, so you're building this network, and you got your next door neighbor, and then you've got, your son who is intimately involved with your medical.
Right. So let's say the answer is yes. We've used role-based permissions within the platform and that just in more English terms, that just means we've segmented things based on people's access. So for instance, let me talk about the enterprise for a second. We have a primary user. So a primary user I'll use the term doctor, okay? That doctor has a certain set of patients. So he has access to those patient records. He cannot see other patients in the platform unless he's been given access to those, because they're not his patients. Very similar to most EHR setups. Now, if the doctor has, medical assistants or other folks, that are working on his team, they would only have access to that doctor's patients. So we built the system in that fashion to allow the segmentation of who can see what. Now, on the side of the patient, you mentioned, Steve, about like a neighbor or whatever, so when a neighbor connects, that's because the person has given the individual, the patient has given them access. And we have something called selective share. What that means is you can share everything with your spouse, but maybe not everything with your second cousin. Okay, or so you have this ability to share segments of the information with various people. I think the other part of the way we handle this is HIPAA really doesn't apply to me sharing my data with somebody. If I wanted to share my medical record with everybody that was driving down 83 in Baltimore, I could just get a billboard and put all my medical records up there. I wouldn't be violating anything because I'm doing that. So just like if I want to connect to my neighbor and share with him, that's okay as well. And the doctors or the care teams, they are seeing that these people are asking other members to be their maybe their healthcare power of attorney or whatever it is. Somebody that's involved in taking care of them when they go home. Then they can talk to them as long as they've been given access to that individual. So
great.
Another thing I would add, this is Jim, to the audience, is that these questions that are coming in are the typical questions that we receive from many of our providers and people that use the app. And there are many, many, many more kind of iterations of these questions. And I would highly suggest that if people could reach out to us for a one-on-one demonstration where we could really dig down into this, because we have really thought about the nuances of sharing information, connecting people, and having it work as easily as possible, and are always refining it. So I would highly suggest that.
Yeah, and I just glanced at the clock, and it's past 1 o'clock here. Just speaks to how interesting and engaging your product and this topic is. And so I think we pretty much answered most of the detailed questions, but one of the things that I'll let you guys make some closing statements, but then what I'm gonna do for the audience, as always, is I'm gonna send out the recording, we'll send out the transcript in chat, and John Butterfield made a suggestion. I'm gonna send that out in an HTML, I'm gonna post it to a web page as opposed to sending it as a PDF doc like we usually do. That'll make it easier for you to cut and paste the chat transcript. And then I'm also going to send out contact information for the team at ICmed, because I think this was an excellent update and recommendation, but I think if folks can have one-on-one with you guys on their individual situation, it'll be helpful. And so with that, any sort of closing statements before we wrap things up today?
Yeah, so, we are not like other systems, and I say that very candidly. We tried very hard not to fit into those categories of telemedicine. And we consider ourselves to be nimble telemedicine, patient and family-centered communication. That was the whole goal. And if we can create that level of communication on basically a higher level of communication, then we think we can actually move the needle on bettering outcomes. And that's been our goal primarily from day one. So, and I think we're doing that, and very easy to get started. It's about a 24 to 48 hour startup period for an organization. So we're not like other EHR systems and other systems that they might be using. So we're excited to be able to help. And I think with COVID, I think it's definitely accelerated everybody's interest in this. So please do reach out if anybody has any questions.
Great. Any other thoughts that the panel would like to add before I wrap things up?
Great. Thank you, everyone. Yeah, I love it. And, as Jim iterated, if there are follow-up questions, and we would like to get connected with you, if you and your organization, be it an assisted living, location, organization, or CCRCs out there, or even a doctor's provider's office, we would love to talk to you, give our demo. So please get in touch with us. And, I've given my email address as well as others' email address in our chat boxes.
Excellent. All right, guys. Well, thanks a lot. And like I said, I'll follow up with everybody.
Thank you, everyone.
Thank you very much, Steve. Thank you for the opportunity.